The reason why I've come to see Dr. Palin is because I've heard a lot of good things about him. I also know that Dr. Palin is a surgeon and he understands facial anatomy really well. And I've heard stories from other people where they've not really gone with somebody that's properly qualified and things have gone pear-shaped. So I think that was one of the main deciding factors for me, that he knows exactly what he's doing. I just want it to look natural, subtle, so the procedures that I want done, I just want just slight enhancements, not majorly drastic kind of change, which I've seen from his work that he does really, really well, and you can't tell you've had anything done. So another one of the main reasons I chose to come to Dr. Palin was I've heard a lot about their aftercare, and I've heard that they've got a 24-hour helpline. So if you're worried about anything, you can come to and ring them, and they have qualified clinicians that'll speak to you, and if need be, call you back in just to have a look and put you at peace of mind. For me, because I'm a panicker, that was really important for me, and I've heard that not many other places offer that.
Roxanna's 46 years old and she actually looks very good for her age. So when Roxanna came to me, she was quite concerned with a few aspects. She was quite concerned that she'd lost the volume around her cheeks. She was also concerned that she didn't have that definition around her jawline and chin, and that her face kind of merged into her neck as well. She was also concerned with perhaps the depth of her nasolabial lines. What we decided to do with Roxanna was do a cheek augmentation, which is focusing around the filler around the beauty point here and extending backwards and a bit forwards as well. What that does, it restores the natural volume that youthful people have to their cheeks, and it softens these nasolabial lines here by raising the skin upwards. And instead of focusing the filler around here, which can give you more the monkey-like appearance, it gives the more natural lift that she wanted. We then started to do a jawline and chin augmentation. There was two main issues. The first was that the chin itself was quite broad, which is more masculine. The second was there was no definition between the face and the neck itself. I tackled this in two stages. The first stage was focusing on the chin. So from a frontal plane, I wanted to make the chin more narrower. I did that by targeting injections of filler close together on the chin to give a more pointed appearance, and that restores the heart-shaped face from this frontal plane. From a lateral plane here on the sides, I would then insert filler along this area here. Now, unfortunately, as we get older, we lose collagen and the skin is affected as well. But not only that, we also start to lose bone density, and the bone, especially along the mandible here, starts to regress, and as a result you lose that jaw definition. What I did was I inserted filler along this angle here to restore the appearance of the mandible bone. What that does is it tightens this skin here, and that, along with the new filler in the jaw, pulls the skin across, giving a nice definition along here. To finish off, I then used a series of cannula injections along the jawline to fill in any areas which were deficient. This gave a nice definition between the face and the neck. Towards the end of the procedure, Roxanna then mentioned that she wanted something done with the lips, but she didn't want that artificial, almost trout-like appearance that some girls have. What Roxanna expressed was she wanted a more defined appearance, and she wanted to maintain a Cupid's bow. So what I did is I did a nice outline of a very fine filler around the edge and also enhanced a Cupid's bow. Because I'd worked quite a lot on the top lip, I then did subtle injections of filler along the bottom lip to make sure that they were even. In Roxanna's case, she did contact me after 2 days. This was to say that she had a tiny bit of swelling just underneath her jawline. I explained that this can happen and happens in around 1 in 10 patients, and I was able to reassure her that there was nothing to worry about. I did say that if there was any further concerns or she was not happy, to contact me at any point so that I could either advise her or bring her in for further assessment. Doing this, I was able to put Roxanna's mind at rest. As always with Dr. Palin Aesthetics, we always review clients at a 2-week mark. So at this further consultation, all the swelling subsequently subsided and the results were fantastic. She was very happy with everything, but I felt that just on one side it could do with a further top up, just to give further symmetry to her face. So no one's face is perfectly symmetrical, but what I try to do is to create more symmetry with every client I see. Roxanna was very happy to go ahead with this, and I included this in the original price quoted to her. It was a pleasure working with Roxanna, and I'm so happy I was able to give her the result she deserved.
I was really nervous when I came in, and I think I was more worried about I'm not going to get what I want, because I thought I don't want it to look unnatural, or like some people you can really tell they've had work done to their face, and that was not what I wanted, and I just wanted slight enhancement. Well, despite Dr. Palin being a male doctor, which was one of my concerns, because I thought like a woman really understands what you're after, and you know, maybe he's not going to understand, or he's not going to be really bothered, or he's going to be too stern and I won't be able to tell him exactly what I want. But he was really, really nice, and he was calm, and he was reassuring, and he was like, I just want to know what you want. He asked me a lot of questions, went into quite detail of how I wanted things and what I was expecting and what kind of results I was looking for. I think that really helped, because I was able to explain to him proper, and I didn't feel like I couldn't tell him anything, so he made me feel quite comfortable, and I explained everything that I wanted, and I think he did get it really spot on, and I was really happy with the results. And the fact that he was talking to me all the way through the procedure and telling me what he's doing made me feel really, really comfortable. I've had friends who've had procedures done even with the numbing cream on, and they've been in a lot of pain, so I was really expecting to feel a lot of pain. And he said to me, oh, you're going to feel a sharp scratch, but to be honest, I didn't really feel anything. So I was really relieved, because I'm one of those that a little bit of pain and I'm jumping out of the chair. I think I was really relieved that Dr. Palin did my procedures, because anybody else I would have been really, really nervous, but he's got a good knack of calming people down, and I think he really listened to me, because I'm really, really happy with the end result. So initially, when I was telling my friends I was going to get this treatment done, my friends were quite skeptical, and they were saying to me that, oh, sometimes you can look really unnatural, and you know, what if you don't like it? But now that they've seen my results, a number of my friends have asked me for Dr. Palin's number, because they said it looks so nice and natural. I definitely recommend Dr. Palin to all my family and friends, because I'm really happy with the results.